The purpose of this video is to demonstrate an option to reduce the incidence and impact of blade skive on the anterior, posterior and distal femoral resections. Under-resection of the femur associated with blade skive may occur due to multiple factors and anatomic considerations. One approach to reduce the under-resection incidence and impact is to shorten the resection and resect softer bone. This can be achieved by revisiting the distal, anterior and posterior resections. Multiple factors such as hard sclerotic bone, cartilage or saw technique can result in blade skive. The longer the resection, the more impact the blade skive may have on the under-resection. This can result in the final and planned resections not being matched by a matter of millimeters or degrees. Often, femoral component flexion or visual gaps may be the result of under-resection of a different resection. For example, an over-resected anterior chamfer visually may actually be an under-resected distal resection. The Attune femoral trial is designed to fit on an accurately cut bone, with a built-in gap at the anterior and posterior chamfers. There will be no contact with the bone at these locations. Rails on the chamfers prioritize contact on the anterior, posterior and distal surfaces of the femur. The Attune cementless femoral component press fit is designed for press fit of 0.75 mm on the anterior and posterior resections, a 0.45 mm press fit per side on the lugs, a line-to-line fit on the distal resection, and line-to-line on the peripheral rails of the chamfers. Saw technique is an important factor in reducing the potential for resection inaccuracy. Hold the saw handpiece gently to allow the VELYS robotic-assisted solution to adjust the resection plane. Wait for the motor of the saw to reach full speed prior to engaging the bone. Initialize cut by creating a clean entry point, allowing the saw to engage the bone without plunging. While cutting, advance or retract the saw blade to avoid cutting with the side of the blade. This will ensure the sharp end of the saw blade is used to resect bone. Begin resections on either the outer periphery of the medial or lateral compartments. First, perform all the conventional femoral resections: distal, anterior, posterior, posterior chamfer, and anterior chamfer. Now revisit the distal, anterior and posterior resections, this time making short cuts in cancellous bone as the hard sclerotic bone and cartilage has been removed. It is recommended to verify checkpoint before verifying distal resection. Move the pointer across the resection surface to compare the resected bone surface to the planned resection plane. If the check demonstrates bone remaining above plan, revisit resection. Revisit the resection and re-verify. Revisiting the resections can reduce the impact of blade skive. The resected surfaces should now match the planned target planes. Flexion upon impaction may occur even with perfect bone cuts. Attune Knee System Surgical Technique Guide for best practices avoiding flexion during impaction should be consulted.